Out of a series of bills proposed this legislative session intended to remedy a hospital staffing crisis in Oregon, disagreement stemmed from this one, mandating nurse-to-patient ratios and imposing penalties should hospitals fail to meet them. A committee heard some emotional testimony from nurses a month ago about the current working conditions.
Could you imagine what it feels like to be proficient and competent at a job you love, yet not have the ability to do your best because you're continually being pushed to do more and more by your employer?
You're pushing these people past their breaking point, and that should worry you.
At that time, hospital admins and the Oregon Association of Hospitals and Health Systems spoke out against the bill, believing it would threaten access to care.
Patients and their loved ones are going to lose if this bill passes.
Several weeks later, both sides reached an agreement, introducing a lengthy consensus amendment at a work session Tuesday.
I am very proud, and I'm not exaggerating about this, of the advocates that are here with me who worked diligently together for months to find solutions to a very tough problem and land on something that we believe is going to work for all of the parties.
Key components to the newly amended bill include a nurse-to-patient ratio written into state law that varies depending on hospital setting, from the ER to the ICU.
1 nurse to 1 patient for trauma patients in the emergency department during active labor and delivery and in operating rooms. 1 nurse to 2 patients in intensive care units. 1 nurse to 3 patients in intermediate care units.
The bill also establishes groups within hospitals that will adopt staffing plans that work for their particular workplace. The enforcement of the ratios will be based on complaints, and there's built-in flexibility to deviate from the ratios if necessary.
A limited number will be allowed for a limited number of time, because sometimes it's the right thing to do to take in that extra patient.
Safety is kind of a low bar, right? Nobody wants to just think I'm only keeping patients safe.
Matt Calzia is a registered nurse and works for the Oregon Nurses Association. He said while they hope to bring nurses back to the bedside with this bill, it's aimed at keeping them from leaving in the first place.
You want to really engage holistically and know that you're providing really high quality care that's going to help folks. And hopefully, we're going to start moving in that direction.
So the bill is now moving forward. Another work session is scheduled for Monday. If it eventually becomes law, the ratios themselves would not go into effect until June 2024, with enforcement going into effect later still. We will continue to follow this and other healthcare bills as they progress through the legislature. David?
Thanks, Elma. Appreciate you staying across this for us.